Hi, welcome to Birthing Naturally with Dr. Mahima Bakshi. A lot of couples might find it difficult to conceive despite following everything that they're told to do. Yes, you must have heard of IVF conception, but there are a lot of myths behind it and a lot of confusion that people go through. I have the best expert here who's going to personally tell you everything that you wanted to know about IVF. Dr. Nandita Palshetkar, who is the president of Federation of Gynecological Society of India. She is an IVF specialist and she's been practicing in this field for more than 25 years. She's been practicing with Fortis La Femme, Fortis Gurgaon and Leelavati Hospital, Mumbai. And I would also like to mention, she's one gorgeous, beautiful woman, not just from the outside but inside. She has a beautiful heart, and the first time I saw her, she swept me off my feet for sure. Hi ma'am, welcome to the show. It's a pleasure having you here, and I can't tell you how much I've waited to just get time from you for this show because I've been really excited to do this with you. And how has been your journey, first of all, as the president of FOGSI? Amazing things that you've been doing. How does it feel?
I think it's been really amazing. I've been, really been busy for the last 6 months since I took over. And today I feel that FOGSI has become a brand, and we are invited for all policy making decisions by the government, and also we've floated a lot of activities which is centered around the woman. The woman is the center of my existence, and I think I'm really happy that I can bring about a change. So it's been really amazing time and very busy, and I think I was also excited to be with you.
Oh,
okay.
Wow. I'm honored. That's lovely, ma'am. So we're going to start with the questions, and my first question to you is, what are the major factors behind infertility, especially in the metropolitan cities?
If you look at it, 10 to 15% of our population is infertile, and usually the causes are because of the man and because of the woman. If you look at the women in nowadays in metro cities, I feel the couples don't get a chance to be together. I mean, a lot of times when I've asked them, yeah, the wife is working in some other city, husband is here, or their hours are so bad that they get exhausted by the time they come home. So that is one of the factors, and I think stress, pollution is also leading, and autoimmunity is leading to problems. But if you look at the gross causes, it's usually because of something like endometriosis, some infection of the tubes. Any fibroids generally don't cause infertility unless they are inside the uterus, in the cavity, acting like a copper T actually to prevent pregnancy. Then the other problems like a little bit of thyroid dysfunction can cause this problem. And if you look at the male factor, 50% of the infertility is because of male factor. So it's very important that husband and wife are investigated together. If this couple has lived together for 1 year, has had unprotected sex and still not conceived, then both husband and wife should be examined.
And I still feel that in India, when it comes to not being able to get pregnant, the question always comes on the woman.
But in metros the awareness is better. The awareness is really much better, and I feel in the cities nowadays the girls usually come with their husbands. So it is definitely much better. I think in Bombay there's more awareness. Delhi probably there is a little bit of shyness, and usually the girls come with their families, the mother or the mother-in-law. So yes, there is a difference.
Yeah, so important for both the partners to get checked if there are issues with fertility happening. So also I would like to ask you, is it possible to have a natural conception in 30s? Because a lot of times nowadays that people are getting married at a later age, so they also kind of think that if they're getting married post 30, a natural conception is not possible.
That's a real myth. I think you can naturally conceive even at 42, but the chance reduces. So yes, in 30s it's very good age group. Usually under 35 is what we tell you to have a first baby. And as technology changes, you get to have different tests which will actually tell you that you're normal. So if you just do a semen analysis of the husband and a serum AMH, it's a blood test of the girl, and this is a hormonal test which will actually tell you how good is your fertility. And it's a good, you don't go 100% by it, but at least it gives you an idea. Okay, you can wait for a couple of years, or better not wait, get pregnant faster. So I think naturally, yes, the first try is natural. If a couple comes to me after marriage and they've told me that, we've not been able to conceive, I ask them for how long. So they should at least try for 1 year before giving up. Because the conception rate is around 10%, 1 in 10 couples, conceives every month. And by the end of the year, 8 couples at least conceive. So I think we need to give it a natural try, especially if absolutely nothing is wrong.
Also, ma'am, tell me, how commonly do you see patients coming to you with male infertility?
I think today's generation, or rather if you see the incidence, it's about 50-50. So if you look at male infertility, very poor counts. The normal count is about 15 million per ml, but counts like 2 million, 3 million, 5 million, those are nearly 30% of the patients, where the male infertility is very, very severe, and we try and treat them with medicines or with surgery. But if that doesn't work, then we have to go for IVF. So that is the treatment for male infertility.
And is there any age factor involved for male infertility as well?
I think there's no age factor for male infertility, but the faster the couple comes, the better it is. The other day I was sitting in the clinic, and a young couple walked in, she was about 23, he was 25, 26, and he had a semen analysis report showing 0 sperms. Now in such a patient, there's no other treatment. We had to find out whether there's a block. There was no block. So only test tube baby can help him. So then it doesn't matter whether you're 19 or 20 or 30. You need test tube baby. So I think if you don't conceive, it's better to do the test, so that at least we know that can we wait or can we have to expedite.
No point in wasting more time, right? And I also see PCOS becoming a very common factor in women these days. So how does PCOS affect the fertility of a woman?
PCOS has become an epidemic. I think it's probably a lifestyle, sedentary lifestyle, a lot of stress, and junk food diet. So I think that is leading to a lot of PCOS. PCOS affects fertility in about 50 to 70% of the patients. There are a lot of patients in whom PCOS does not affect their fertility at all. They have children and they are happy. The only thing they develop is probably diabetes, blood pressure later on in life if they are obese. But in those cases where fertility is affected are usually those patients who don't get their periods on time. There's delayed period, and that's because of ovulation does not occur properly. And how we need to treat them is we normally give them lifestyle or behavioral therapy, meaning to lose weight. Even 5% weight loss will actually regularize the periods. So it's very important to understand that, walking every day. I tell my patients simple. If 3 to 4 times a week you can do exercise for 1 hour, that would really help your PCOS. And of course the diet. But another problem is the lean PCOS.
Yeah, that was my next question. Is there also something called lean PCOS?
Yes, there is, and she's really thin, and she has anovulation, and there's nothing that you can do except give her medications. If the woman is a little plump, you can tell her to lose weight and her periods may normalize, but when she's thin, it's only medication.
Right. So any wellness tips that you would like to give to women who are undergoing IVF, any lifestyle modification needed for that?
I think no smoking, no alcohol, no drugs. Then the other thing is a good nutritious diet. There was a very beautiful article, on nutrition, and Mediterranean diets are supposed to be good, but even protein-rich diets are very good. So I think a healthy I would look at it like a healthy balanced diet, which gives you a lot of nutritional, minerals and antioxidants, etc. That's why the Mediterranean diet, all the colors in the Mediterranean diet gives you lots of antioxidants.
Yeah.
So I think that Plus, I feel exercise is very, very important. You know, you go for a walk or you do whatever exercises that your body is used to. Those things are important. And if she's obese, weight loss is really helps.
So there's nothing like an IVF conception that
diet.
cannot follow exercising in pregnancy, or an IVF conception has to be kept on complete bed rest for 9 months only because she's undergone IVF. Maybe in certain cases, yes, but not for every case, right?
This is something I really need to tell your viewers. IVF does not mean bed rest.
Yeah.
In fact, when I do IVF, after 15 to 20 minutes, the patient goes home and she's on house arrest, not bed rest. So she can move around in the house for 3 to 4 days only. That's when the implantation happens. And after that, most of the girls go back to work. And you don't need bed rest even throughout pregnancy. Now, only if there's an obstetric complication,
Right.
you know, something which is related to pregnancy, then depending on the condition, that also. If the placenta is really low, then we tell you not to move around, not to exercise, not to have sex. But otherwise, I think there should be no.
Which is also a possibility in any non-IVF pregnancy case as well. And is there any other risk factor involved during the pregnancy for IVF cases? Any other extra care that needs to be taken?
I really don't think so.
So it's
Except
just
that,
as
you know,
normal as any other normal
Yeah,
pregnancy.
except that, you know, sometimes it's a precious pregnancy after 10 years of marriage, and the women may be older. You know, if they're 40 plus, etc., then the different aspects of an older woman with pregnancy, of course, we have to care for them and
Right.
treat them differently.
Right. Also, is there any risk of a preterm baby after an IVF conception?
See, in IVF, if supposing 10 women have conceived, 1 or 2 may have multiple pregnancies. And the minute when you have twins or triplets, the chance of preterm delivery definitely increases. And that is what we need to, take care of. But the way my twins are, like if you give them good rest, allow them good food, take care that there's no infection, vaginal or urinary, then they really go to full term.
I think that's quite an amazing information that we've got about IVF and pregnancy and then the post-delivery bit. Any one last tip that you would love to give to the mothers who've undergone IVF and are probably about to deliver? Any one last tip for all those moms?
I think enjoy. This is the beautiful phase of your life. It's been something you've been waiting for. So just don't do things that will harm your baby, like smoking or drinking. Please eat good food, good exercise. Walking is good for you, and enjoy. That's my advice to you. Don't stress.
Thank you so much, ma'am. It was wonderful having a chat with you. Thanks a lot for sparing out time. And I would like to give this copy of Birthing Naturally to you. And thank you so much.
Have you
Hoping to
signed
see
it?
you again. No, I'm quickly going to sign it.
You have to.
And I would love to take a picture with you for the book.
Thank you.